So we had an Elotuzumab presentation, and we had a Daratumumab presentation. So briefly, Elotuzumab is a monoclonal antibody targeting a molecule which is called SLAMF7. So this molecule is highly represented on malignant plasma cells. And so we did phase 1-2 studies in the past showing that the combination of Elotuzumab with lenalidomide and dexamethasone was a very effective regimen. And so what we got at ASCO and what we will have today at this meeting is the report on the large phase 3 international study designed for registration. So the study was designed for relapse refractory patients having received 1 to 3 prior lines of therapy. The control arm is lenalidomide and low-dose dexamethasone, and the investigational arm was Elotuzumab, lenalidomide, and dexamethasone. And so the study had 2 primary endpoints, so the response, and the response rate is much better with Elotuzumab. It's 79% versus 66%, and the PFS is also significantly better for the Elotuzumab arm. So there is a response benefit, there is a PFS benefit. So the survival is not mature yet, but we might expect a survival benefit as well. And the other good news is that the Elotuzumab is very well tolerated. So there is we got very few severe adverse events, approximately 10% of infusion reactions, but usually these infusion reactions are mild, it's not severe. So this is an effective regimen and a well-tolerated regimen, and I am sure it will make a difference for myeloma patients. The other major antibody, I should say antibodies in fact, are CD38 monoclonal antibodies. We know three anti-CD38 monoclonal antibodies. So the one is Daratumumab, which is a fully human antibody. We have also another one which is called SAR, which is a chimeric antibody, and there is a third one which is called MOR202. So we have 3 antibodies against CD38. CD38 is likely a major target in myeloma. It's highly represented on malignant plasma cells as well. So it's a very nice target for myeloma, and we got results on Daratumumab, and what has been presented at ASCO and what will be presented today as well is a phase 2 study in very advanced myeloma patients using Daratumumab as a single agent. Also, it's important to say that these patients had received the vast majority of drugs for myeloma. Many patients were refractory to pomalidomide, to bortezomib, to lenalidomide. So that's a very heavily pretreated population, approximately 100 patients. And so the response rate is very promising. So approximately 30% of patients got at least a partial response with Daratumumab given as a single agent. And so the majority of these patients were able to stay on therapy for a long period of time. The tolerance was very good as well. And so the median time to progression is approximately 8 months. So it looks great for patients, and as you can expect, we have a lot of ongoing studies with Daratumumab in different settings, so for frontline, for relapse, for smoldering myeloma, for maintenance. So it's very, very good news for patients. I think the take-home message for clinicians is that antibodies will play a major role in myeloma therapy, and these drugs are effective. These drugs can be combined with other myeloma drugs. There is no overlapping toxicity. These combination regimens incorporating immunomodulatory drugs, proteasome inhibitors, and antibodies will be likely extremely effective for patients. So this is that will be a major advance in myeloma therapy.